For those of us that are dealing with clients, let's jump maybe a little bit away from the marketing, but now let's say you're at the first visit, right? So you were successful in your marketing, they've come in, but you're still sensing a little hesitation, a little anxiety. What have you learned, and what did you maybe teach Melody in your office about how to approach those people that do have some reservations and fear?
I always ask like if they have any questions, but if I sense that sometimes people would just say like, I want to do this because I haven't been feeling well for so long, but I'm also really afraid of needles. And like, maybe they're afraid they're going to pass out, like when I put the first needle in. So I will really encourage them to ask any questions that they can think of. I'll also ask them, do you want me to explain the whole treatment process? Like, I'm going to leave the room and let you get undressed and get on the table, and the table is heated, and then I'll knock before I come back, and then I'll take your pulse. Like, for a lot of people, it helps to communicate, like, what is every step going to look like? They don't want any surprises, right? So some people, that makes them feel better. Some people are like, I'd rather not know what's coming. It depends on the person. But like asking them a lot of questions and making sure that they know they're allowed to ask me any question they can think of, even if it's minutia, if they're afraid it's going to be a stupid question, helping them feel comfortable, that tends to help a lot.
Yeah. Yeah, it's interesting when we looked at all the research around communication with patients. Any form of autonomy, any ability for them to choose, even if you're giving them a fake choice, like, do you want to come in twice a week for 6 weeks or 3 times a week for 4 weeks? They're both 12 visits, but if you choose it, it's way more powerful. And just
Yeah.
offering them the choice of like, do you feel free to ask any questions you want? I'm going to guess most people are like, no, it's fine. I'm good, or they're not asking, but opening that door for them is powerful, right?
Yeah.
And conversely, forcing anybody into any medical treatment has been shown like that's a really good way, even if it's what they come in for. Like, you think about surgeons and it's like, oh, you're scheduled for a hip replacement. Like, we know exactly what the treatment is going to be. We know what's going to happen, but not allowing any questions, not allowing any banter or back and forth, it like doubles your chance of a malpractice suit. And what's crazy in that is you're still performing a successful surgery. You still replaced their hip and gave them what they wanted. But yet there's this level of psychology where it's like, yeah, but you didn't let me choose or ask questions, right? And it adds that. So that is diffusing the situation quite a bit there. And then I do think it's funny when you're saying tailoring communicate, or we say tailoring communications, but for the detail-oriented person that comes in, that comes in with a backpack and they're reading in your waiting room, they're reading one novel, and when they put it away, you see they have multiple books in their backpack.
Yes.
They're just information hounds. That's how they handle everything in life, right? And so they want to know not just, what is this word, but what does that even come from? Where does acupuncture come from? And when you explain it and feel their thing, the great news is not only does it quell their fear, but they become a lifetime patient because
Yes.
they like to see people. Once you filled that up, no one else could ever challenge you. It's like, no, Michelle knows everything and she's willing to share it. Yeah. And then they never leave. So it's pretty exciting.
Yeah. Yeah. I think you're right that a lot of people will say, no, I don't have any questions, or they're flustered and they're like, well, I can't think of anything right now. And then reassuring them like, yep, or I'm sure I'll have questions later. I'm like, okay, good. Like, if you have a question and we're in the middle of something, just tell me. And you know what? In the past couple of years, I have also started saying like, because the cosmetic acupuncture in the face it can be 80 points, right? So I'll always tell people when I get started, like, I've been doing this a long time and I'm very fast. But if at any point it's too much, we could totally take a break, right? Or if it's too much, I know other styles and we can downshift to something that's only 30 needles in the face. I also don't tell them the number of needles before I get started. I think that's need to know information they don't need to know. But yeah, just communicating and being so open and helping people understand, like, it's your world. Like, I'm not really in charge just because I'm the healthcare practitioner. Like, you tell me what you need. And sometimes it's not easy to convince people that they can interrupt you and ask questions, or they can pause the
Yeah.
treatment, or they can be like, I really have to pee.
Yeah.
Before we do this, I have to pee, because they are so used to a medical system where they are not in charge. It's
Mhm.
like we're all being retrained.
Yeah, well, that's a great point because yesterday I had to go for a blood test. And so I've been to that place before. There's always a long wait. It's always a nightmare. So I was like, well, I better pee before I leave. And I get there and she's like, oh, we're doing a urinalysis. I'm like, oh my God. Like, but just prepping people, like, because if you told me, hey, you have to get 80 needles in your face for facial acupuncture, to me, I'm like, so I'm going to be laying on this table for what, 2 hours, 3 hours, maybe? In my mind, I'm just like,
Right. Yeah.
I've
You'll
had
be there probably 50 minutes.
right. I've had dry needling in my knee, and that was 5 needles. So I'm just like, well, that took 15 minutes. So,
Gotcha.
multiply that by 8 and I'm here for 2 hours.
Yeah.
But just giving them that prep of like, you're gonna lay here for about, an hour, maybe a little less. And then offering, do you need to use the restroom or something, is probably very powerful for the people with anxiety. Because again, no is if they answer no, remember, no's like our first control word in life, right? Babies say no when they finally have an ability to resist.
Yeah.
And yeah, so it's funny that we miss all these points with patients, and yet to us, it's like, well, this is the 1,000th person I've done this.
Right.
Are there any questions?
Well, we forget sometimes it's like the first experience they've had.
Thanks for tuning in to this episode of Trust Driven Insights, brought to you by TrustDrivenCare. Imagine a world where all your patient communication is in one place, seamless, effortless, and on autopilot. That's the power of Trust-Driven Care. If you're ready to streamline your practice, check out TrustDrivenCare.com and see what's possible. Trust-Driven Insights. Real conversations. Smarter care. Stronger business.